Steve Moran here at the Senior Living Innovation Forum in Napa. You might recognize some old video that we did 2 years ago in the same setting. And I want to welcome you to another episode of the Senior Housing Forum podcast. And I am talking to Gene Makesh with Lantern Group. And you're doing, well, tell us a little bit about what you're doing.
We are an assisted living and a memory care provider. There's a reason why we do both. We do AL and memory care. We are known for memory care. However, memory care is only 30% of our business. The reason we do both, Steve, is as of today, when you look at the data, only 9% of Americans do not have the risk to develop Alzheimer's disease. Only 9%.
That's a pretty scary number.
It is. So we as providers, what is that we can do now as of today? Because if we don't, there's a very good chance you and I would be needing services, and we may not have what you and I enjoyed all our life when we retire.
So your goal in having assisted living is to do things to be preventative, is that what I'm hearing?
Absolutely. Studies show that brain markers such as amyloid plaques and tau-containing neurofibrillary tangles, the brain markers, they're beginning to see that in a 19-year-old brain. Does it mean that they have the disease? It's like this: just because I have wrinkles, it doesn't mean that I'm old.
Well, I mean, actually, it's interesting you say that, because I had a brain scan that was essentially normal, but I have some of those, and it was a little scary to me. But I don't think I've got any other symptoms other than this brain scan, and they weren't extensive, but still a little bit nervous-making.
Oh, absolutely. So what we did as an organization is developed two programs. One program to prevent or delay the manifestation of the symptoms. See, you and I, there's nothing we can do at this point. Once you have the disease, you cannot stop the disease from progressing. It will progress. It is going to progress. However, is there anything that we can do to prevent the manifestation of the symptoms? And we have a program called Jive, and that's what we do on the AL side. On the memory care side, we have a program called the SWAYS. On the memory care side, we have clients that already have manifested symptoms, and we see certain deficits either in their cognitive domain or their IADL functions. Through the SWAYS program, our objective and intention is there anything we can do through cognitive restructuring, cognitive reformatting, through activities, through exercises and supportive pharmaceuticals? Is there any way if we could expand the functional size of the human brain? There's nothing you and I can do to stop the progression of the disease, but can I increase the functional size of the human brain by introducing the elderly to new learning?
So what do you see?
We've had this program the last 5 years, and we've had some success. And again, fortunately or unfortunately, we haven't seen to this day a client or an individual with just Alzheimer's disease alone. Especially by the time they come to us, they're in the late 80s or early 90s. Along with Alzheimer's, they have other comorbid conditions that also impact and influence the disease process. However, with the design that we have a design called biophilic environment. To the design we have, and along with the program, we have been able, in some cases, we were able to keep them functional. We had a client a couple of years ago, we were able to get the client to bathe herself, and that's huge. One of the things that we commonly see in our, in some of our buildings, I would say 2 of our buildings, is, and it may not sound a lot of progress, but for a client and the family, I think it is. The client usually, by the time they get very close to passing, at least a week ago, prior to the death, they were able to walk. They were able to do things. We were able to prevent them from being in a jerry chair. And I think that we felt was very huge.
So, as you know, my audience is senior living operators, providers, some capital providers, mostly operators. Can you talk about some specific things that operators could do, either, well, really in all three, whether we're talking about the IL space, the assisted living, or memory care, that they could tap into at least some of what you've learned to do in their own communities?
Oh, absolutely, absolutely. I would encourage them to consider brain as a muscle. And when you talk to a bodybuilder, what do bodybuilders do? They don't use the same weight every single day. They don't follow the same routine every single day. They don't do the same exercise pattern every single day. In addition, they also augment the muscle building process through proper diet. If we see and treat brain as a muscle, my recommendation is doing puzzles are good. I would say they're good for maintaining. However, if we could subject the brain, expose the individual to new learning. New learning is very important. It's important to practice what they already know because we don't want them to lose it. However, if we are able to subject them to new learning, something that they're not comfortable with. For example, if you throw anything to do with medicine, I'll grab it and run with it. If you throw anything to do with business, I'll grab and run with it. However, if you throw something related to algebra or calculus, I'm going to struggle. That puts me in a very uncomfortable position, something that causes pain. So my recommendation is if they can come up with activities, exercises, that would inspire and motivate new learning, that can be very helpful.
Okay, so this is kind of blowing my mind a little bit because what I understand about dementia care in particular is that the goal is to reduce agitation, and the way you do that is really by not challenging them. And you're actually suggesting doing just the opposite. Do I get that wrong?
Not exactly.
Help me with this.
I was having a conversation with an architect couple of hours ago, and I was telling the architect that the architects and the designers actually have the power to be part of the treatment process. The way they go about creating spaces that are relevant to the client, not to the family, but relevant to the client. What I mean by that is our brain has the ability to process certain colors, certain configuration, certain spaces a lot more efficiently than certain other designs. There's a reason why a child care is designed a certain way. There's a reason why a spa is designed a certain way. And creating a space that's very, very relevant is important. So starting with that, creating a space that's very relevant, that you find a way to minimize the conflict. We call them dysfunctional expressions. Behaviors. Behaviors is nothing but a form of expression. Dysfunctional expressions like anxiety, depression, agitation, combativeness, elopement. Many of those dysfunctional expressions could be directly as a result of, we call it extrinsic factors. There are two factors, intrinsic and extrinsic. Extrinsic is something that we get from the environment. Intrinsic is internal. It can be because of pain, infection, and many other things. So if we can use the space effectively and efficiently, create a space that's relevant to them, where the brain has to work less to process all that information. All our five senses, every single time, we are processing information. There's something called involuntary learning. We learn without paying attention to things. We just see it once and it gets registered. Where if there's an emotion attached to it, it becomes a strong memory. Every memory that is formed in us, there is some form of emotion associated with it. It can be a good emotion, it can be a bad emotion, a pleasant, unpleasant emotion. So using the environment to minimize, once we are able to get there, then we introduce our clients to new learning.
Cool. Cool. So I really like this a lot. And where are your communities located?
We have 3 communities right now.
Okay.
They're all in Ohio, outside Cleveland. One is in Chagrin Valley, the other one is in Saybrook, and the third one is in Madison, Ohio.
Just in case I or somebody wants to come visit, right?
Oh,
So,
absolutely.
That's what I wanted to ask.
We would
So-
love you to come visit, spend
Good.
time with us, learn about the program. People always ask me what I do for a living. I always say that I'm in the business of giving people hope. I think it's important for us to have hope. If we don't have hope, then there's nothing for us to work towards. And every single time we keep telling nothing can be done for the elderly or nothing can be done for someone with dementia, Alzheimer's, that takes away the motivation for us to get involved and do anything and everything humanly possible to help those individuals.
Well, that's cool. Well, listen, I appreciate your participating in this podcast and want to thank you for listening. If you've got a story that you think ought to be told here, our goal is to chat with people who are doing new and interesting things that we all can learn from together and get better as we care for residents and care for teams. So appreciate your listening and watching, and I appreciate your time, and
Thank
I'll
you,
let you back to your meeting. Thank you.
So much, Steve.